turn our attention to Yemen now, which last week marked 5 years of conflict, a deadly proxy war between the Saudi-led coalition and Iran-backed Houthi forces, which has left millions suffering. In fact, it's been dubbed one of the worst humanitarian crises of our time. That's 16 million people in dire need of clean water, sanitation and hygiene. Now, last year, Yemen was hit by the worst cholera outbreak in modern history, and today it's bracing for the coronavirus pandemic. For a clearer picture of what's happening on the ground, I would like to welcome Tamuna Sabadze to the program. She's the Yemen country director at the International Rescue Committee, and she joins us from Tbilisi. Thank you so much for being with us. The fear that we have for Yemen is that it's already a breeding ground for disease. We saw that with the vast and rather deadly spread of cholera. Tell us more about the conditions on the ground, if you can.
Thank you for having me. Yes, I agree. This is actually a nightmare scenario for Yemen. And as you correctly mentioned, we have just marked the 5 years of the war in Yemen that has left the basic infrastructure and economy devastated. And this is affecting millions and millions of Yemeni lives. 80% of the Yemeni population, which is roughly 24 million people, are in some kind of in need of some kind of humanitarian assistance. And no surprises there that it has been dubbed as the world's largest humanitarian crisis to date. I can think of very few countries that can be less prepared than Yemen today.
You just mentioned that the economy is devastated. We're also talking about a country here where households are already lacking basic services, where the healthcare system is already extremely fragile.
It is. And more than half of the health facilities in Yemen currently are not functioning. Educated doctors and nurses, a lot of them have fled the country, and those who are still in country have not been continuously paid for 2 years. So IRC, for example, is incentivizing such medical personnel in the health facilities that we support. Currently, we do not have the confirmed cases of COVID-19 in Yemen. However, there are fears that by the time it is first discovered, it would have already spread in the country. Yemen ranks in the bottom 5 of the 195 countries and territories assessed by the Global Health Security Index to cope with such scale epidemic outbreak. Yemen is really not equipped to deal with such an outbreak.
Now, you just mentioned that a large number of doctors have actually had to flee the conflict. Can you talk us through what NGOs like the International Rescue Committee are doing today to help prepare for the arrival of the pandemic? And frankly, will these levels of preparations be enough?
Yes, of course. So International Rescue Committee has already started training the health workers on recognizing the disease and identifying, isolating the cases when it comes. We are also actively engaged in the awareness raising about the virus and the prevention measures among the population. We have started replenishing our stocks of hygiene supplies to help prevent the spread of the virus. This will be distributed among the populations, as well as we are working on the cash distributions because, as you know, the impact of this virus is not only on the health of the people, but also there's an economic impact, and households usually refer to the negative coping mechanism and reducing the meals and the stop of the income. So we are trying to address this by the cash distributions.
Now, lastly, the US has just cut millions of dollars in healthcare programs and aid for Yemen. Surely the impact of this is going to be devastating, especially at a time like this. Very briefly, if you can respond to that question.
It is true, and right now Yemen needs more funding, not less funding, to help address the impact of this outbreak. What is important is that the warring parties work with the humanitarian agencies like IRC and all the other international organizations to ensure that the aid reaches those who need it. And this will also trigger the donors to increase the funding and give us the support we need to prevent this disease from taking more lives than absolutely necessary.
Indeed, devastating political decisions that are being taken by the international community. Tamuna Sabadze of the International Rescue Committee, thank you so much for speaking to us here on Middle East Matters.